Everyone, this is Professor Chandler. So I just wanted to do just finish out our lecture. Unfortunately, we had a little late start due to some different technology difficulties and things. So anyways, just wanted to kind of give you the rest of the lecture, which focuses on autism. So when we look at autism spectrum disorder, this disorder falls under the pervasive developmental disorders, or PDD. And so what this group of disorders is characterized by delays in the development of socialization and communication skills. And autism is the most studied one, but it also includes Asperger's, childhood disintegrative disorder, and Rett syndrome. Now, Rett syndrome, you'll notice, is in your book. It's just got a little paragraph. So it's good to be aware of it, but it's nothing that we're going to focus on in this lecture. So a diagnosis of autism spectrum now includes several conditions that used to be diagnosed separately. So we've got our autistic disorder, pervasive developmental disorders not otherwise specified, and Asperger's. And together these are called autism spectrum disorder. So like we started to talk about, there's a wide variation in presentation and severity of children that have that fall within the autism spectrum disorder, or ASD. Anywhere from mild with an Asperger's to very severe autism, which are the two most common types. And about 1 in 68 children in the U.S. are diagnosed with autism spectrum disorder, and they're looking into reasons why these numbers continue to increase. There's no cure. However, early detection and lifelong interventions and support are required. So some of the causes, like we mentioned, that there's really no one particular cause that they've been able to identify, but research suggests that autism develops from a combination of genetic, non-genetic, or environmental influences. Some of the genetic factors include either spontaneously, either a known or unknown propensity towards it, or having a sibling with ASD also increases the risk. And then, of course, we talked about Fragile X syndrome, which is one of the known genetic causes of autism. Environmental, there's research being done regarding pesticides, different medications such as valproic acid or thalidomide. And then there's also an increased risk if the parents are older, if there's a sibling with ASD, and then also if there's pregnancy and birth complications, including low birth weight, multiple pregnancies, or extreme prematurity. There seems to be a decreased risk for moms taking folic acid before and at conception and throughout the pregnancy. And there's at this time no increased risk related to vaccinations. Typically, it's diagnosed, according to McKinney, by age 3. However, your HESI book and, like I said, the CDC and other references say by age 2, and sometimes as early as age 18 months. And this is done through developmental screening and specific behaviors, and requires 2 particular characteristics. One is the deficits in social communication. The other is restrictive, repetitive behaviors interested in activities we'll talk a little bit more about. So indicators of autism spectrum disorder. Social skills, we're talking about things like poor eye contact, resist physical contact, inability to relate to people in age-appropriate ways, inability to respond to social and emotional cues, labile emotions. Infants may not have a response to the smiling response to parents, no repeating of parental cues like waving, clapping of hands, no response to parents trying to get the child's attention. Like when a parent calls out the child's name, they may not respond to that, but they may respond to a truck going by or something like that. And then also, they tend to lack understanding of other people's emotions and have difficulty regulating their own emotions, which can result in behavioral issues like tantrums and outbursts. As far as communication is concerned, they typically have some delayed speech and language. Typically babies start babbling at certain ages, and so this may be delayed as well. And then echolalia, which we talked a little bit about, which is the repeating of noises and phrases or compulsive repeating of what is heard. They may have robot-like speech, Sometimes they don't understand sarcasm and they're very literal in what people say and how they respond to things. And they may even give unrelated answers to questions because they're fixated someplace else. Repetitive behaviors, these include hand flapping, head banging, rocking, turning things over and over, turning lights on and off, spinning in circles, and having obsessive interests. Emotional attachment. This creates a problem with parental bonding, where there's a lack of parental attachment and cuddling. And then ritualistic behaviors. What we're talking about here is, they can tend to be very rigid in their routines. So again, like we talked about with Down syndrome, having a child in the hospital, we would want to make sure that we have an idea of what their routines are and try to keep that sense of routine as much as possible. They also may continually be lining up objects, playing with the same toys over and over again. They may eat only certain types of foods or colors of food. They may have difficulties with textures of foods. They have difficulty with changing order and routine. They also may have some self-injury behaviors, such as hand biting and different things like that. They can be impulsive. They may have some hyperactivity. And then they also may have some unusual reactions to way things sound, smell, taste, look, or feel. So you may see children in the autism spectrum disorder wearing like headphones in public places. I know a couple, that tend to do that. And just not all the time, but, sometimes they come and they've got the headphones on just to kind of regulate the outside noise. So this is a little video. I'm not going to play the video because you guys can do that directly from the PowerPoint, but I just thought that it does a good job of talking about the developmental milestones and things that parents should be looking for as their child grows and develops, and some of the signs for concern. So please take a couple minutes to watch that. So Asperger's. Typically, our Asperger's patients have an average to above average IQ, and a lot of times they have good language development. They don't necessarily show the level of disability that we see in some of our more severe autistic kids. And then sometimes they have normal and often very high levels of intellectual and language development. They primarily struggle with social and emotional difficulties. So again, they have some difficulties with social cues, knowing what's socially appropriate, space, invading personal space and abiding by social norms. Sometimes their conversations are fixated. Like one kid I know, was very, very fixated on birds for a while and then on other things at different times, history at different times. So they get very fixated in their conversations, or they may want to, one is a younger child that I know, was always fixated with lights and flags. And, if there was any of those in the room or anywhere within sight, it didn't matter what you talked about, it always went back to the fans or to the lights or the flags. They can also struggle with clumsiness, handwriting, and organization. And then emotionally, a lot of times they're very, very friendly, but they may have difficulty maintaining relationships due to some of these social issues that we just discussed. So these here are just a couple infographics just to kind of reinforce some of the things that we're talking about here. And these are specific to Asperger's. So if you like that kind of thing, it may help you kind of just run through like the focus, the definition, some of their social difficulties, and some of the characteristics that go along with this particular syndrome. So when we think about nursing care, what are some assessments that you as the nurse should provide to an autistic child and to their family? So I hope that you'll kind of go through your book, kind of look at the materials in the PowerPoint and other reference materials that you may have as well, and just kind of do some critical thinking about that, because that's the kind of stuff that, you know the basics, you can memorize stuff, but this is where the critical thinking comes in to help you in your test taking and in anticipating and caring for your patients. But some of the particular assessments that we need to pay attention to is, assessing developmental levels. We also need to do an assessment for self-care. Is our patient able to perform self-care? Do they need total care? Are the parents, are they the primary ones that perform the self-care as the child gets older? And just kind of learning a little bit about those, because again, it goes back to routine. If the child is used to bathing and dressing, then we want them to bathe and dress as much as they're able to, so that we're abiding by those routines and keeping them as independent as possible. We should also do an assessment of the family coping skills and provide supports. What are some community supports? What are some maybe some in-hospital supports? Maybe they need some counseling. Maybe they need some pastoral help. So what is the support needs of the family and the child, and how could we help them in their journey with a child with autism spectrum disorder? And then again, assessment of the normal routines. And this just comes with asking a lot of questions and doing a lot of listening and doing a lot of observing. Secondly, what are some nursing diagnoses for the autistic child and the family? So I'm not going to give this one to you. You guys can look it up, but before you even look them up, just think critically, because that's going to help you kind of get your head into, really learning what an autistic child, caring for an autistic child is like, so that you could begin to think about what would my nursing diagnoses be that I would base my interventions on. So when we talk about nursing interventions, one of the primary things that we want to remember, again, goes back to preferences and routine, maintaining consistency when possible. We want to also make sure that we're determining cues to help the child remain oriented to their new environment, because being in the hospital, that's going to be a new environment for them. So some things that we can do is, allow them to have their favorite toy or favorite object, and trying to maintain a calm environment, because remember, sometimes they don't respond well to a lot of activity changes and a lot of auditory stimulation as well. Let's monitor them for anxiety, okay, because it's a different environment, so we want to be looking for that and asking the parents, how do the behaviors that maybe we're seeing right now, is there anything different, that would indicate anxiety? And then determining how the child communicates. Is the child verbal at all? Are they able to answer simple questions? Involve the family, use short, direct sentences. Maybe the child uses a little bit of sign language, or maybe they use pictures or signs. If you're assessing for pain, they may be able to point to the face scale for pain, but may not be able to give you a number. And allow extra time for a response from the child. They may not answer you right away. Being patient, like somebody said in class. And then providing a safe environment, especially if we're seeing self-stimulating behaviors, because we don't want to see them getting hurt. So we want to make sure that, that their safety is of utmost priority as well. And then, of course, allowing the parent or a family relative to remain with the child, so that there's that constancy and as much normalcy as possible. And again, like we talked about with our Down syndrome, providing anticipatory guidance. These kids are still going to go through the life stages. What are some particular things that we can help the parents anticipate, as they go into childhood, as they go into puberty, as they go into college age and into adulthood, and what are the resources that maybe we can refer them to. And then what collaborative or interprofessional services may be needed. So again, here, providing referrals for community services, support groups, respite care, and then also maybe directing them to the Autism Society of America. A big key for our autistic kids is specialized behavioral programs. So this is one of the areas that, from what I was reading in McKinney and with the CDC and different Autism Speaks, which is another organization, the behavioral programs are a really big focus. And what these do is they focus on promotion of communication and interaction, and help begin to work with the child to replace the stereotypical behaviors with more normal ones. They offer stimulation, and they provide established routines, as well as providing safety precautions for self-injurious behaviors. And so these behavior therapies are kind of a foundation of treatment for most of the children that are in the autism spectrum. They also may need physical therapy, occupational therapy, speech therapy, some social skills training, feeding therapy. I have a friend that I know that has a young autistic daughter. I think she's probably about just over a year to 2 years old or so. And she's one of the ones that really struggles with eating because of the textures and stuff like that. So she actually just recently began a feeding therapy program. And very interesting. That was something new for me. I didn't realize that that sometimes can be a part of some of the difficulties, but also part of the therapy. And then, of course, our primary care physicians and pediatricians, keeping regular appointments, making sure that immunizations are being done, and that regular assessments of developmental milestones are being taken care of in the office as well. So this next slide is a case study, and you can actually pause it here and think through it. This will give you an opportunity to apply the information and see what you come up with. So I'm not going to go through this. Maybe you guys can get together in some study groups and go through these questions here, and it should help you get a good handle on caring for a child with autism. And this again here is just another resource. This is one where I pulled some of the information from. It had a lot of great stuff. And one of the things that I liked about this on this particular page, and this is just, a lot of it's just reference. You don't have to read through the whole thing or anything like that because it's kind of lengthy. But it has a section for different life stages that parents can download, and gives them just a ton of information. So part of professional development and growth, which is part of our CUSIN competencies, and part of your learning objectives is being a perpetual learner. So, one of the reasons that we give you some of these things is to help you be able to find those resources that are reputable to be able to learn and grow as you continue in your practice. So I hope this was helpful. Shoot me an email if you have any questions. All right, thanks.